Catherine is so good at embarrassing me. So it's one of her skills in addition to many others. Catherine, I should say a few words though, is incredible. In other words, has incredible energy, vision, and steadfastness to bring this about. So if nothing else, we should have an International Day of Hope in honor of Catherine. In other words, because she's done so much. And I think she brought hope to a lot of people in addition. There are other people to thank. In other words, also for here, I think we need to thank Tom Dean. We wouldn't be here today if it weren't for him, so thank you very much. And for his sustaining the efforts of IFRED Foundation over these years, so that's quite exceptional. We have to thank Walmart, in other words, who've made this possible in many different ways, and we hope that they will sustain the hope of the foundation and others, so it's really great. I'm going to say a few words. I'm not very good as a public speaker, but I do want to say some things, and they come from my experience. So I'm very concrete. In other words, as a psychiatrist, and I'm a psychiatrist, I should be more abstract, but it turns out that over the years I'm very concrete. And it really is time to acknowledge hope. It's critical to the survival of individuals in society. This is a time when despair is rampant and conflict is so present globally that anything and everything that can be done to enhance hope is necessary. And the people in this room are doing it in their own ways, in other words, and we need to do more, okay? If the United Nations thinks about the Sustainable Development Goals, there isn't a single Sustainable Development Goal that wouldn't be enhanced, in other words, and brought to fruition if we didn't have more hopeful individuals and more hopeful societies. I think the United Nations has to recognize that and do what it can in addition to everything else that it tries to do to support hope as an intervention, in other words, as a way to bring this about. Hope, as Catherine alluded to, it was seen as kind of wishy-washy. In other words, oh, I'm hopeful, in other words, I hope things work out okay for you. But through research and through experience, there's now ample evidence, in other words, that hope is no longer an amorphous concept, but it's teachable. In other words, Catherine and her curricula and people in other parts of the world who've used the curriculum have shown that it's teachable. I witnessed that myself in Ireland when I went with Catherine to see what they had done with school children in teaching hope. There's also, in other words, the fact that hope, in other words, has been shown to be researchable. In other words, there are many studies on hope, in other words, around the world now, and with good methodology. In other words, I think maybe the early time the methodology wasn't so good, but we have very good methodology now and many ways to measure hope. So we have the capacity to measure hope. We have hope scales, we have other measures of hope. So this is very important. Hope enhances survival. In other words, I think we have to keep that in mind. In other words, it enhances survival for everyone in this room, actually. If we didn't have hope, probably wouldn't be where we were, in other words, in terms of facing different kinds of adversity. But hope has been shown to be important medically and surgically, in other words, to help patients. In oncology services, and there's literature is quite large in oncology and cancer therapy, that individuals with hope and being able to support hope enhances outcomes, extends life for individuals. I personally witnessed hope, in other words, as was alluded to before. I worked for Dr. Joseph Murray, very famous, in other words, surgeon, and he won the Nobel Prize for kidney transplantation. But he was a head and neck surgeon, and he dealt with patients who had devastating illness. I made rounds with him because one of my jobs was to work as the consultant for the surgeons at Boston Children's Hospital. He never spoke with patients about prognosis. In other words, many of these patients really had fatal illness. He never talked about their prognosis. He always talked about what the next operation, the next procedure would be. And in his way, offered hope, right? In other words, if you're focused on what your next procedure is going to be, you don't think that your life is going to end at that point. So it was a remarkable lesson for me to see him functioning in this particular way. He didn't have to do it. In other words, he certainly could have just walked away and said, okay, I did the best I could, and that's the way it is. So I think that we need to take into consideration how hope should be more a part of what we do in our professional lives and other lives. I was fortunate. I worked for the World Health Organization for a number of years, and I went to Thailand and Indonesia after the tsunami, and it was devastating. Just whole towns were wiped out. But I was able to see that the people who had hope, in other words, had some kind of future orientation and were thinking that way, were able to survive. Unfortunately, the people who didn't have that really, in the devastating situation that they were in, couldn't survive. So it's really important to think about hope in that way. Now is the time to bring hope to the forefront and infuse global health initiatives with what we've learned about hope. Global health is popular today. Everybody talks about global health. In other words, we have departments of global health, we have this global health initiative, etc. What we really need to do is to make sure that when we're talking about global health, that along with vaccines and medications and this, that, and the other, that we have hope as one of the ingredients of what we try to offer. And we use what's been learned in terms of teaching hope, in other words, to make these global health initiatives more potent, more useful to the civilizations where they're being promoted. I want to say in closing that we really do need, in other words, to support hope in every possible way. And I think if we could have an International Day of Hope sponsored by the United Nations, then in fact we would have a vehicle for bringing more attention to this very important aspect of our lives. Thank you very much.